Ever heard of a condition kind of like, I don't know, sneaks up on you?
Oh.
Like a stealthy ninja? It just like wreaks havoc before you even know it's there.
Hmm.
Well, that's Abdominal Compartment Syndrome, ACS for
Yeah.
short. And that's what we're diving into today. We've got some excerpts from a medical presentation on this very topic.
Okay.
And trust me, it's a wild ride.
Yeah, it is.
So buckle up as we explore what ACS is, how it affects you, and why catching it early can, well, it can be a lifesaver.
What's so fascinating about this is people, we just kind of often overlook the complexity of the abdomen. It's not just a cavity where we digest our food.
Right.
This is a dynamic environment, has its own internal pressure system. We call that intra-abdominal pressure, or IAP.
Okay, IAP, got it. But why does it even matter? Most people, we're not walking around thinking about the pressure inside our bellies.
Right. You wouldn't. But it's actually crucial for our bodies to function correctly. Think of your abdomen like a well-packed suitcase, right? You've got all your organs, fluids, tissues in there, and they need a bit of pressure to stay organized and work properly. That's IAP at play.
So it's like having the right amount of air in a car tire.
Exactly.
Not too much, not too little, right?
Exactly. Now imagine sitting in a car with the tire that's slowly leaking air.
Right.
You might not notice it at first,
Right.
but eventually it's going to cause problems. It's the same with IAP. When it gets too high or it stays high for too long, that's when things can really go wrong,
Okay.
leading to what we call intra-abdominal hypertension, or IAH.
IAH. So basically it's like high blood pressure, but inside your abdomen.
You got it. And just like with high blood pressure, it's not always a 5-alarm fire. We measure IAP in millimeters of mercury, or mmHg. A normal range is usually between 0 and 5 mmHg. And even everyday activities like breathing, eating, laughing cause it to fluctuate a bit.
Wow, I had no idea. So when does it actually become a problem? Like, what are we talking about here?
Well, when IAP consistently stays above 12 mmHg, that's when we start to pay attention.
Okay.
Doctors have a grading system for IAH.
Yeah.
It ranges from grade 0 to grade 4, higher grades indicating more severe pressure.
Gotcha.
And while IAH itself is a concern, it's crucial to understand that it doesn't always mean you have full-blown abdominal compartment syndrome, or ACS.
Okay, so IAH is like the yellow light,
Yeah.
a warning sign.
Yeah.
But ACS is like red light, full-blown emergency.
You got it. Think of ACS as the tipping point. It's when that elevated pressure in your abdomen starts to cause real damage to your organs, like your heart, lungs, kidneys.
Right.
We're talking about a sustained IAP of 20 mmAg or higher, coupled with signs of organ dysfunction. And unlike IAH, which has those grades, ACS is an all-or-nothing situation. You either have it or you don't.
So ACS is like flipping a switch. It goes from, oh, this is a potential problem, to we need to act now.
Exactly. And the causes of ACS can be surprisingly diverse, which is why it's so important to understand the different ways it can develop. Broadly, we categorize it into 3 main types: primary, secondary, and recurrent ACS.
Let's break those down.
Sure.
What makes each type unique?
Absolutely. Primary ACS, as you might guess, is usually caused by something happening directly within the abdomen itself.
Okay.
Imagine a hard blow to the stomach,
Yeah.
a ruptured appendix, or even severe inflammation of the pancreas, pancreatitis.
Okay.
These are situations where pressure builds up very quickly because of bleeding, swelling, fluid accumulation.
Okay, so it's like a pressure cooker situation
Yeah.
happening right there in your belly. What about secondary ACS? What triggers that?
Secondary ACS, that's a bit sneakier. It's not caused by an issue originating in the abdomen.
Okay.
It's from something happening elsewhere in the body. That eventually impacts abdominal pressure. Think of it like a domino effect. For instance, sepsis, a severe body-wide infection, or conditions that require a massive influx of fluids, severe burns. These can lead to secondary ACS.
Wow, so it's not just what's happening in your abdomen, it's how other conditions can indirectly impact that pressure system. And finally, we have recurrent ACS. What sets this one apart?
Well, as the name suggests, recurrent ACS occurs when the condition returns after initially being treated.
Right.
This can be due to a variety of factors. Someone with liver cirrhosis, a condition that often causes fluid buildup in the abdomen.
Right.
Or someone on peritoneal dialysis, where the abdominal lining is used to filter waste products from the blood. These folks might be more susceptible to recurrent ACS.
So it's like your body has developed a sensitivity to changes in abdominal pressure.
Yeah.
So it makes it more vulnerable to ACS, like rearing its ugly head again. And this is where it really hits home that ACS is a complex beast.
It is.
With multiple contributing factors, right?
Yeah.
You're absolutely right. It's not a one-size-fits-all condition, and that's why early recognition and understanding the potential causes are so important.
Absolutely. And speaking of understanding, we've touched on how ACS can affect multiple organs, but I'm curious, like, what's actually happening inside the body when someone experiences ACS? How does that pressure impact these different organ systems?
That's a great question.
Yeah.
And it's where things get really interesting and a little scary. You see, increased pressure in the abdomen doesn't just stay put.
Right.
It's like squeezing a balloon in the middle. The pressure has to go somewhere.
So it's like that pressure is a bully, just like pushing its way around,
Yeah.
causing trouble wherever it goes.
That's a great analogy. And one of the first places that it often causes problems is the cardiovascular system.
Yeah.
Think about it. Increased abdominal pressure clamps down on those major blood vessels.
Right.
Like the vena cava, which is like the superhighway bringing blood back to your heart.
Oh, wow. So it's like a traffic jam in your veins.
Yeah.
Making it harder for the blood to get where it needs to go.
Precisely. And when that happens, it puts a huge strain on your heart.
Yeah.
It's trying to pump blood, but it's fighting against that increased pressure.
Right.
This can lead to a drop in blood pressure, an irregular heartbeat, we call that arrhythmia, and it can even increase the risk of blood clots forming.
Wow. That's scary. And it's not just the heart that takes a hit, right? We
No.
talk about how ACS can affect breathing.
Absolutely. Think about how you breathe for a second. Your diaphragm, that dome-shaped muscle below your lungs, it contracts, it relaxes to pull air in, push it out. But when ACS strikes, that increased abdominal pressure pushes up on the diaphragm,
Okay.
making it harder to do its job.
So it's like trying to take a deep breath with like someone sitting on your chest or something.
Exactly. And the result is your lungs can't expand as much,
Oh, wow.
leading to shortness of breath, a feeling of tightness in your chest, and a drop in those all-important oxygen levels.
That sounds terrifying. What other organs are we talking about? What gets caught in this pressure cooker nightmare?
Well, your kidneys are particularly vulnerable.
Okay.
Remember, they are responsible for filtering waste products from your blood.
Right.
They need good, strong blood flow to do that job effectively.
Right. Like a car wash needs a steady stream of water to get those cars sparkling clean.
Exactly. But with ACS, that blood flow to the kidneys gets compromised.
Yeah.
It's like turning down the water pressure at the car wash. Things start to back up. You might see a decrease in urine output, electrolyte imbalances, and in severe cases, you can even see kidney failure.
It's like your body is under attack from the inside out.
Yeah.
Are there any other organs that we haven't talked about?
Believe it or not, even your brain isn't safe from the wrath of ACS.
What?
Remember how that increased abdominal pressure affects blood flow?
Yeah.
Well, it can also impede blood drainage from the brain.
Wait, so this pressure in your belly can actually impact your brain. How does that even work?
Think of it like this. The veins carrying blood from your brain, they have to work against gravity to get that blood back to the heart.
Yeah.
But when ACS increases pressure in your abdomen, it's like adding another obstacle to that already uphill battle.
So it's like trying to swim upstream against a strong current.
Exactly. This can lead to fluid buildup in the brain, what we call cerebral edema, and that can cause a whole host of problems, from headaches and confusion to seizures, even coma.
This is incredibly serious. And to think all of this can stem from pressure building up in the abdomen, it really highlights how interconnected our bodies are.
It certainly does, and that's why early recognition and treatment of ACS are so crucial.
Absolutely. Speaking of early recognition, how would someone even know if they need to be worried about ACS?
Right.
What kind of symptoms should raise a red flag for someone?
That's the tricky part. ACS can be a master of disguise, especially in its early stages. The symptoms can be quite subtle and easily mistaken for something else, like indigestion or a stomach bug.
So it's like a wolf in sheep's clothing.
Precisely. But there are a few key things to watch out for. Abdominal pain and swelling are common, of course.
Right.
But pay close attention to how you're breathing. If you suddenly find yourself short of breath, especially if you haven't been exerting yourself, that could be a sign that increased abdominal pressure is affecting your diaphragm.
So unexplained shortness of breath, definitely not something to ignore.
No.
What else should people be on the lookout for?
Keep an eye on your bathroom habits.
Okay.
A decrease in urine output or difficulty urinating can be a red flag.
Yeah.
Remember, those kidneys need that good blood flow.
Right.
ACS can disrupt that.
That makes perfect sense.
Yeah.
So we've got abdominal pain, we've got breathing problems, we've got urinary issues. Anything else we should add to this list of warning signs?
You might be surprised to hear this, but pay attention to your heart rate. If you notice your heart's kind of racing or pounding, even when you're at rest, that could be your body trying to compensate for the reduced blood flow back to the heart that's caused by ACS.
It's like your body's sending out an SOS signal.
Yeah.
Through like a rapid heartbeat.
Exactly.
So what should someone do if they experience one or more of these symptoms? I mean, can't imagine this is something you just wait out, and see what happens.
Absolutely not. Don't hesitate to seek immediate medical attention. It's always better to err on the side of caution.
Especially because early diagnosis and treatment are just so crucial for improving outcomes in ACS.
Exactly. The sooner you catch it, the better the chances of preventing serious complications and long-term damage.
This has been incredibly eye-opening. I feel like we're really starting to grasp just how serious ACS can be. But now that we understand the dangers and the domino effect it can have on the body, I'm curious about what can be done to treat it.
That's a great question. And the good news is there are effective ways to address ACS.
Okay, good.
But it often requires a two-pronged approach.
Okay.
Medical management to stabilize the patient, and in many cases, surgical intervention to actually relieve the pressure.
Okay, so it's not always about surgery right away.
Not necessarily. The first line of defense often involves what we call medical management,
Okay.
which focuses on ways to reduce that pressure within the abdomen without immediately resorting to surgery. Think of it as damage control while we're buying time to try to address the underlying cause.
That makes sense. So what kind of tools are in the medical management toolkit? So we're talking about ways to bring that abdominal pressure down without immediately having to go into surgery. What kind of things are we talking about here? It's not like you can tell someone to just take a chill pill and expect their insides to cooperate, right?
Oh, you're right. It's a bit more involved than that. One of the first things we do is optimize the patient's positioning. Think about it. Lying flat can actually make abdominal pressure worse.
It's like trying to zip up those jeans after a big meal.
Exactly.
A little strategic readjustment can make a world of difference.
Exactly. So we might elevate the head of the bed, adjust their posture, or even use special beds. They help distribute pressure more evenly. And these seemingly simple changes can actually make a surprising difference in relieving that pressure, giving those organs some breathing room.
So strategic positioning is key.
Yeah.
What else? What else is in the medical management kind of arsenal?
Medications. Medications can play a crucial role.
Oh, right.
For example, we might use pain relievers, sedatives, just to kind of help manage pain, anxiety, which indirectly that can help reduce pressure by allowing those abdominal muscles to relax a bit.
It's like hitting the reset button on your body's sort of panic response.
Exactly. And if fluid buildup is part of the problem, diuretics, medications that help your kidneys remove excess fluid, those can be incredibly helpful.
So it's about attacking that pressure buildup from multiple angles.
Yeah.
But it sounds like medical management is often just the first step, right? Sometimes surgery is unavoidable.
That's right. While medical management is our first line of defense, there are times when surgical intervention becomes necessary.
Yeah.
This is especially true if the pressure is so high that it's causing organ damage that we can't reverse with just medications and positioning alone.
So that's when we're talking about surgical decompression.
Right.
Literally like opening up the abdomen to release that pressure.
Exactly. And it's a big decision, not one that we take lightly, but in severe cases of ACS, it can be life-saving.
Yeah.
By surgically opening the abdomen, we can immediately relieve that pressure on those vital organs.
Right.
Give them a chance to recover.
It's like hitting the reset button, giving the body a chance to kind of heal.
That's a great way to put it. Now, in some cases, especially if the underlying problem is complex or the body just needs more time to heal, we might not close the abdomen right away.
Right.
Instead, we might opt for something called temporary abdominal closure, or TAC.
We touched on this earlier,
Yeah.
but it's such an intriguing concept. It's like
Yeah.
hitting pause on the healing process.
Exactly. With TAC, we're essentially creating a controlled, sterile environment for that open abdomen while the body does its healing work. Think of it as a temporary external shell for the abdomen.
So it's not about stitching everything back up right away.
Right.
But allowing the body to heal from the inside out first.
You got it. And during this time, the patient will need, specialized care, frequent dressing changes, close monitoring in an intensive care unit.
This makes me think about the recovery process after TAC. It sounds pretty intense.
You're right. Recovering from TAC can be challenging, requires a lot of patience, a lot of dedication. Imagine having this open wound that needs constant care.
Yeah.
And the added challenge of having to relearn how to use your core muscles once that abdomen is finally closed. It's a long road.
It's like running a marathon.
Yes.
You've got to pace yourself and be prepared for the long haul.
Absolutely. But here's the good news. With the right medical care, a strong support system, and a whole lot of determination, many people who undergo TAC, they go on to make excellent recoveries.
That's reassuring to hear. Well, as we wrap up this deep dive into abdominal compartment syndrome, is there anything else you want to leave our listeners with?
I think the most important takeaway is this. Listen to your body.
Yeah.
It speaks to us, sometimes in very subtle ways. Those seemingly minor aches, pains, discomforts, they can be warning signs of something more serious. If something feels off, don't ignore it, right? Seek medical attention. You know your body better than anyone.
Couldn't agree more. And as you said earlier, knowledge is power. The more we understand about, how our bodies work and the potential things that can go wrong, the better equipped we are to advocate for ourselves.
Absolutely.
And make, informed decisions about our health.
Absolutely. And never hesitate to ask questions, especially when it comes to your health. Your doctor is there to guide you, provide the information you need to make the best choices for your well-being.
Well said. This has been an incredible, incredible deep dive, and I feel like we've covered so much ground. We went from unpacking the basics of intra-abdominal pressure to, exploring the complexities of surgical intervention and the long road to recovery. It's amazing.
It's been a pleasure joining you on this.
Yeah.
Hopefully we've shed some light on this condition that often flies under the radar, but can have significant consequences if not addressed promptly.
For sure.
And effectively.
To our listeners, thank you. Thank you so much for joining us on this deep dive into the often overlooked world of abdominal compartment syndrome. Remember, knowledge is power, and being proactive about your health can truly make all the difference. Until next time, stay curious, stay informed, and as always, take care of yourselves.